Hey everyone, it's Dr. Shalini Gupta, the Dermatology Laser and Vein Center, and today I wanted to talk to you about all the different types of procedures and things we can do here at the Dermatology Laser and Vein Center to help you get a mommy makeover without surgery in a minimally invasive, less invasive way. So childbirth, of course, is just the most amazing experience in any woman's life. You're giving birth to a new being in this world, and it is life-changing, and it is magical, and it is amazing. Of course, it can leave our bodies in a pretty battled state as we go through this process of giving birth and breastfeeding and nourishing our children. So what are some things we can do that we deserve to get ourselves back up on our feet and looking great and sexy again? So a lot of things happen during pregnancy, and I'm just going to go through some of those things that occur and what we can do here at the office to help you recover from those tortures that happen on our body. So one thing that some women notice, many women notice, is loss of hair right after childbirth and sometimes even during pregnancy. So we encourage everyone to continue taking your vitamins and to make sure that you're eating healthy and taking good care of yourself in other ways. Usually the hair loss is temporary. It's called a telogen effluvium, and it actually happens quite commonly, almost universally. I will say after my second pregnancy, I thought I noticed actually my hair came back, so that was interesting. But if your hair does not return back to normal after a few months, especially after breastfeeding and after you're back to normal, then we can help you with a procedure called PRP to help those hair follicles be nourished and revive themselves and start growing more in anagen phase and get them out of that sort of telogen effluvium where they have been in shock from all the changes occurring in the body, and the hairs have stopped growing. So we can help, like I said, with PRP, we can help with a red light helmet that you can wear at home, and then helping you just making sure that your thyroid, iron, and all those levels are in check, that you're not anemic. And then all kinds of things start to grow. Besides the baby, it seems like we sometimes start growing little cherry angiomas, little vascular growths, moles, and skin tags, and all other types of little skin growths can start occurring. So we can check those out for you, make sure that they are not dangerous to you, and if they are, we can biopsy them. If they're benign, we can use all types of vascular lasers, pigment lasers, lasers that remove moles and get rid of those lesions that are growing on you, and we can do it pretty much in a fairly minimally invasive, non-invasive way where it doesn't leave a scar. So that's great. You don't have to have stitches and surgeries. Also, women notice something called a mask of pregnancy, also known as melasma. Not all women get this. Some tend to be more prone to it. It may be genetic. We don't really know. But it is definitely in relation to hormones, and then sun exposure can make it worse. So if you are prone to melasma, try to wear sunscreen during your pregnancy and try to avoid sun exposure as much as you can. Also, if you're prone to melasma, it may be a good idea to choose a birth control method that does not involve hormones. So instead of taking a birth control pill, try a non-hormonal way to manage that because it can make it worse. And then try to avoid sun exposure, heat exposure as much as possible also. Melasma is a pigment problem that usually occurs sort of on the cheeks, the forehead, the upper lip, and it's not an easy problem to cure of. So we don't actually have like 100% cure for melasma, but we do have some fantastic treatments that help get that pigment off so you can feel more human and normal and not have to wear makeup constantly to try to cover this. So there are some fairly simple laser procedures that will, within a week or so, remove the majority of the pigmentation from your face. And then we also have certain peels, like the Cosmelan peel, that also can be very helpful in managing and controlling the melasma. So if we work together as a team and just stay on top of it, we can really control the melasma and keep it under check long term. And then we also, of course, we gain a little bit of weight. That's just part of the pregnancy process, and sometimes that accumulates, especially around the belly area or the hips, and sometimes in the breasts. And we can help get rid of that fat that you've accumulated anywhere on your body. If it's just a mild amount and not too bad, you can do just a non-invasive procedure like cool sculpting, sculpture. You can also do Vanquish Me, which is great. Some of these procedures also give a skin tightening benefit as they're removing the fat. If it's a little bit more stubborn fat in the area, we can do vaser liposuction and just get really great results in one shot and get that fat out of there. And again, the skin will usually shrink up pretty well, but where the skin has been stretched in certain areas, we can also do a procedure like thermage, which is a radiofrequency procedure with just a little probe under the skin that heats the tissue and helps new collagen fibers to grow, and can have really nice dramatic results in terms of tightening up the skin. We can use that sort of a process anywhere on the body, whether it's on the belly or even the chin area, or the arms or the thighs, the buttocks, love handles. So all of that can be accomplished. We can also use non-surgical skin tightening procedures that also work really good, like ultherapy, thermage, and Exilis Ultra. These procedures have absolutely no recovery time, and one can resume normal activities, and then you will see results gradually over the next 6 to 8 months. And that's true whether we do a minimally invasive procedure like thermage or a non-invasive procedure. But a lot of times we'll do the thermage along with a liposuction procedure, since we're already within the tissue. And if you're doing a non-invasive procedure to get rid of the fat and need a little bit of skin tightening, then we may couple that with another non-invasive skin tightening procedure. So all kinds of options and combinations we can do, and we can personalize that when you come in. We can look over and see what's going to make most sense for you. Stretch marks, that happens. So when the stretch marks are fresh and they're still pink and you're done breastfeeding, that's the best time to come in and start taking care of them. At that point, we can usually use lasers like the V-beam, which is a vascular laser, and it really makes a big difference in reducing the redness and also in remodeling the scar tissue so that the skin has a chance to heal more normally and not leave a scar behind. Now, if the stretch marks are a bit older and they're already set in and they look kind of white-ish, we can use all types of other procedures like microneedling. We can do fractional radiofrequency, we can use profractional laser, we can use Fraxel laser, and all of these have really great results on improving the appearance of the stretch mark, making the skin healthier, and again, making you less ashamed of them, so you can wear perhaps your two-piece again at some point and just feel great. The other thing that happens along with the fat growing in areas like the stomach is that there is a muscle underneath called the rectus muscle, abdominis rectus, and during pregnancy, because we are stretching, it sometimes pulls apart and you get what's called diastasis recti. And that happens sometimes in the first pregnancy, sometimes after the second or third. Almost for sure you're going to have some diastasis recti. And usually the recommended course is to do physical rehab, like a rehab sort of a course afterwards. That is a very difficult thing for a lot of women to do, and if you try to exercise on your own, sometimes you can make the diastasis recti actually worse. So there is a procedure we have in the office that fixes that, and that is just really awesome. So you can watch our video more about the emsculpt procedure. So emsculpt is a procedure that helps to kill fat but it also helps to build muscle. And in clinical studies, it has been shown to pull and make that diastasis recti go away by reducing the gap. So that has been clinically shown through radiographic studies, and I find that really awesome. So if you have that issue, you should come in and get the emsculpt procedure. It's kind of going along the lines of the emsculpt procedure. We can also use that same technology to help strengthen your pelvic floor, because as we age and also during childbirth, the pelvic floor weakens with all those muscles stretching. And of course, also the vaginal canal becomes looser and just not as tight as it used to be. So when we apply that same technology of stimulating the muscles to the groin area, then we actually are emulating something like 14,600 Kegel exercises for you in a 30-minute session. So that's pretty powerful, and it really helps to rebuild that pelvic floor so that you don't have urinary incontinence after childbirth or just as you age. And then it also helps just tighten up all the tissues in that area. So that's also extremely powerful treatment. Staying in that part of the body, other things we can do to help improve the vaginal area, which becomes looser during childbirth, and then also sometimes the labia become a little bit more floppy, which are sort of the lips around the vaginal areas. We can use a procedure called thermage, which is a non-invasive procedure using radiofrequency, and it helps to tighten up all that tissue. And it helps improve lubrication, and it really helps with pleasure as well going forward. So that's really powerful treatment. And the other procedure we do is called a G-shot, where we take PRP. Now this is the same PRP that I was talking about to help your hair regrow. We can also inject PRP in the vaginal area, and that helps to make the tissue healthier by stimulating new vascular growth and by improving lubrication, and makes it firmer as well and tighter in that area. So a lot of times we combine all of these procedures together. So we might do the G-shot with PRP and couple that with the thermage procedure to help tighten tissue, and then we may still recommend that you do the invasive procedure, especially to help strengthen that pelvic floor. So the other area that starts to sag and droop are the breasts. Now usually during pregnancy the breasts grow because all those glands are getting ready to produce milk for your new baby. And after you're done breastfeeding, or if you don't breastfeed, the glands shrink down, and sometimes the breasts are left smaller than where you started. And they may also be stretched, especially women who tend to pump, or they've just stretched those ligaments out. That happens. So we can use a procedure called thermage breast lift. Now this is a minimally invasive procedure, much like I talked about the thermage RF for other parts of the body where a little probe goes under the skin and just heats the tissue. We can do the same for the breast area, and actually we've seen some really impressive results with thermage breast lift. It's a minimally invasive procedure, just strictly local numbing and a tiny little puncture through the skin, so there's no scar, which is really nice compared to, let's say, a surgical breast reduction where you would have significant scarring around the areola and all under the breasts and around the breasts. So with the thermage RF, we can get fairly nice results without you needing to go through surgery. We can also do ultherapy in the upper chest area just to get a little bit lift. The other procedure we can do if you've really lost volume and you would like a little volume back, but you don't want to have breast implants or anything like that, is we can take the fat we've removed from other parts of the body, let's say your stomach, and we can do a fat transfer, and we can put that fat into the breast area. The other thing we can do is if your breasts have grown as a result of your pregnancy and have not been able to shrink back down, is we can do liposuction to actually reduce the size of the breasts and make you comfortable again. So either we can shrink, we can reduce the breasts, and we can tighten and lift the breasts, and that's all possible with the technologies we have in our office, and they're non-invasive to minimally invasive and non-surgical. So now I'm going to show you some pictures to show some of the differences that we can make in the issues that we've talked about. So let's take a look here. This is a scalp where there has been some hair loss, and with the PRP procedure, this is only after just a single treatment. We can see more hair, we can see a thickening of the hair shaft itself, and just more populated regrowth. So very nice here. This is a patient who has kind of that melasma appearance with pigmentation, and here she is just one treatment after. This is an example of liposuction to that pooch that doesn't want to go away post-pregnancy. You can see a nice reduction there. This is another example of a belly. Now this is what's called a RF procedure for tightening, where it's a minimally invasive treatment with a little probe that goes under the skin and tightens the tissue. And here's another example of that. You can see all that loose skin where it's been stretched out is nicely firmed up. And that's about 3 months out, but the results actually get better even over a year. This is an example now of somebody, again, who has sort of that post-baby flabbiness and very stubborn area, even though she works out all the time. And this is after doing a non-invasive procedure called the emsculpt. So you can see a really nice improvement from here to here. And this is the procedure that I was talking about that also helps to bring that muscle together, and it fixes what's called diastasis recti. So that's emsculpt. This is a side view of that same patient after receiving the emsculpt. And a really nice, impressive result. Even the love handles have nicely reduced. And this is an example of how we can improve stretch marks with various procedures we have here in the office. So you can see that they fade away quite well. They may still be somewhat present, but the majority of the skin really does well, and it will take several treatments to make a significant improvement on stretch marks. So usually we recommend doing 3 to 5, but some patients benefit from more treatments, and then others see results faster. So it just depends a lot also on your reaction to the technology and how your body responds. This is an example of breasts that have just sagged, and this is after the thermage breast lift procedure. It's a fairly impressive result. You can see the nipple position and the sagging in the breast has really lifted back up, and this patient was extremely thrilled with the results. Like for example, here you can see how the nipple is pointing more down, and here it's pointing in a more upward direction. And this is an example of the vaginal area where the tissues have just become loose and stretched over time. And this is immediately after doing a thermage treatment to that area. This is an example of leg veins. Actually, that's one of the things I forgot to tell you about, is that women also develop spider and varicose veins on the legs. And we can inject these veins with injection sclerotherapy. I usually like to use normal saline, but we can also use foam sclerotherapy. And these agents that get injected into the veins will cause an irritation inside the vein wall and will cause those veins to just collapse and die off permanently. You may over time develop new vessels just because you're prone possibly to making new veins, but we can just keep on top of that periodically, and it's extremely gratifying. These veins can also be kind of painful and give sort of a dull aching or cramping sensation to the legs, and that all improves when we get rid of those veins. So that is also extremely beneficial. We can also use laser if we don't want to use the injection sclerotherapy, though I do find the sclerotherapy to be more effective personally, and I think it is also a less painful procedure and it works better, and it also costs a bit less than doing the laser, but that is always an option for veins that may not respond to sclerotherapy, or if someone just prefers that over injections. So here's how these veins here, you can see the deep blue ones, the more superficial veins, and they all start to fade away very nicely and go away. So those are the main things. I would say that I want to make sure I'm not forgetting anything that have to do with moms and all the things that can happen to our bodies, because we have done such an amazing job bringing new life into our worlds. We deserve a little bit for ourselves, and these are some things that can help us just feel good again, feel more human again, and help us get on. So hopefully this was informational to you, and we look forward to being of help.